Treat depression. Depression is one of those factors that activate our fight or flight stress response. When we are depressed, we're constantly looking out for threats. We have a negative view of the world, and this chronic stress on our body caused by depression leads to chronically elevated heart rates. This large study showed that because of the excess cortisol and adrenaline produced in depressive states, heart rate becomes elevated. Compared to someone who is not depressed, someone with depression can have up to 0.7 increase in their beats per minute. This doesn't sound a lot, but but treating depression in addition to multiple other factors can, in aggregate, cause significant decreases in your heart rate. If you want to learn more about treating depression, please take this online course on how not to be depressed that I offer as part of my Udemy curriculum. Treat anxiety. Anxiety causes elevated cortisol and adrenaline, just like depression, both caused by that activated sympathetic nervous system response, both resulting in elevated heart rates. According to this large study, compared to people who are anxious, people who are not anxious have a 0.5 beat per minute reduction in their heart rate. It sounds like not a lot, but in aggregate with the other factors can have a dramatic impact on lowering your heart rate. If you believe you're anxious, please visit my online course to learn more about the diagnosis and how to treat it. Sleep well. The recommendation here is 7 hours or more per night with a consistent bedtime. When we don't sleep enough, it triggers that fight or flight stress response. Our bodies were designed to sleep at night, and if we had to be awake, the body is designed to consider that an emergency and prepare to fight or flee. The reasons that keep us up late at night are rarely emergencies. Nevertheless, our body responds as if they were by elevating our heart rates. This large study showed that hitting that threshold of 7 hours a night can reduce heart rates by up to 3 beats per minute compared to those who sleep less. If you struggle with your sleep, I highly encourage you to check out my online course on sleeping.